Initially, before I decided to become a head and neck surgeon and reconstructive surgeon, I was a general otolaryngologist. When I was in practice, I had a patient who came to me with an advanced stage oral cavity cancer. And their treatment would require extensive surgery and reconstruction. And I had met this patient's family, entire family. I had done the biopsy, made the diagnosis, and discussed the options with them. And I was sitting across from them, and they asked me and said, well, Dr. Javadi, are you going to be able to do this surgery for us? Will you continue to be our doctor? And I looked at them and I said, well, I am going to have to refer you to one of my colleagues who does this and specializes in head and neck surgery to take great care of you. And again, that kind of confirmed something in my mind that I had always suspected, which is I didn't want to be that doctor who sent my patient to another physician to take him. I wanted to be that head and neck cancer surgeon who took care of that patient and saw them through this entire cancer treatment. So that was the day when I really decided in my mind that I was going to be a head and neck surgeon. I was going to go back to fellowship, and that's what I was going to do. And in practice, I had always known, again, that taking care of the head and neck cancer patients was what I truly enjoyed doing, what I loved doing. But being in that setting where there was no multidisciplinary conference available where these cases were discussed with all the physicians, it made taking care of those patients more difficult. It also, again, imagine being a head and neck cancer patient. You just received this diagnosis, and you are going to have a lot of questions. You know that you're probably going to have to meet a lot of providers, but if there is not a multidisciplinary setting such as the one we have here, imagine as a patient you would have to go to an appointment to an oncologist on one side of town, to a radiation doctor on the other side of town, to your otolaryngologist on this side of town, and you're already scared. You already have so many questions, and just having to go from one place to the other just to be able to get those pieces of the information, I think is very difficult for patients. And it doesn't necessarily translate into a great experience for the patient as you're going through this difficult time. But here, I think what we have at Simmons is very unique, is that our patients actually come in the morning, right before our noon conference, and they meet the entire team. And we say hi to them, we examine them together, and then we say, we will actually go and discuss your case now with all the members of the team, and when we come back, we will have a plan for you. And then we have our patients come back in an hour or so, and then we sit down again with them and the members of their family, all the members of the team, and we discuss the plan with them. So when they actually leave our office that day, they have met all the providers who are going to be involved in their care, and they have a plan. And we say, this is the plan, and we're going to get working on this for you right away. And I think that makes a huge difference for the patients. I would say the thing that always surprises me still is the strength that I see in my patients every day, because what they go through is not easy, and I am with them as they go through this, but still it is a difficult journey, and their strength and their reserve always surprises me. Their will to live and to go on and be there with their families is really always what surprised me. It's also what excites me, because it is what keeps me going. It is for them that I do this, in the chance that I can help them, be around next year to be with their families for Christmas or New Year, or after having gone through, being diagnosed with head and neck cancer, being able to still function, to speak, to be able to swallow and share a meal with their family once they're done with chemo and radiation, or being able to provide them surgeries and reconstruction that will allow them to be able to do those things that they love to do. I did lose one of my grandparents to cancer when I was very young. My grandmother, who again did not have any traditional risk factors, received a diagnosis of lung cancer, and unfortunately she passed away very shortly after that. And I remember, seeing her go through that. And then more recently, I have another aunt who was recently diagnosed with breast cancer and ovarian cancer, both. And as she went through her treatments, I remember it was very difficult for her, but she was very grateful for the relationship that she had with her oncologic surgeon. They had a great relationship together, and she knew that if she had any questions, it didn't matter, even if it was potentially related to the additional chemo that she was receiving, she would still be able to call her surgeon, and that surgeon would be able to get in touch with the oncologist and find answers for her, or even just sit down and talk with her or answer her questions. And I think, every time my mantra for how I treat my patients is, how would I like my family members be treated? And I think, even though I never met my aunt's surgical oncologist, I knew how much trust she had in her surgical oncologist, and what a great relationship they had. And I can only hope that that's the kind of relationship that I can have with my own patients, and that's what I strive to have.